Hello, my name is Elizabeth Mishoe. I'm a nurse practitioner student at Auburn University. Today I'll be completing a full head-to-toe assessment of my patient Megan. For the purposes of this video, I'm going to have her stay fully clothed to maintain her privacy. Normally I would have her be in a gown so I can better inspect her. I may also only be inspecting one side of her body throughout the video, such as one ear and one eye, and only assessing one side of her reflexes, but normally I would be doing that bilaterally. When I walked in, I already performed hand hygiene. I also already assessed Megan's vital signs, her height, weight, BMI, and those were all within normal limits. I also already conducted a vision exam using a Snellen chart, and her vision was 20/20. To start, I just assessed her general appearance. She is dressed appropriately for the weather outside. It's a little cool. She also walked in without any difficulty. Without any assistive devices. Her gait was smooth and no problems there. Megan, can you tell me how you're doing today?
I'm doing good.
Good. I'm going to start by assessing her head first, looking at her hair, the distribution of it. I don't notice any balding, no lesions, bumps, or abnormalities. Her face is symmetrical. Her eyebrows are both even. Her eyes are in line with one another. I've also assessed the symmetry of her nose, and it is symmetrical. It's midline. I'm going to start by palpating your sinuses. Let me know if you note any tenderness. It's frontal and maxillary. Difficulty. Okay. I'm also going to look up in her nose. It is symmetrical. I don't notice any deviation within her septum. Can you smile for me? Good. Her mouth appears moist. No difficulty there, and her gums appear pink. I'm going to use my otoscope to further assess that. I'm going to look up in your nose, okay? Make sure that there's no redness or that your mucosa is pink and moist. There it goes. Good. If you could say "ah" for me. I don't know any redness in her mouth either. I'm also going to start by looking at her neck and also look in her ears as well. I'm going to palpate her auricles of her ear, any tenderness. She does have some piercings that I noted, but they don't appear red or irritated at this time. I'm going to use my otoscope to look in her ears. I'm going to pull the pinna up and back to note and see if she has a pearly gray tympanic membrane and if she has any sebum in there as well. Good. No irritation. She also has very minimal wax, which is great. I'm going to also palpate her neck. I don't notice any bumps or lesions on it currently. Her trachea is midline. I don't notice any deviation. Alright. I'm going to palpate her lymph nodes. I'm going to do post-auricular, her pre-auricular, her submandibular, postclavicular, anterior, cervical, supraclavicular, and postclavicular. I don't notice any swelling in her lymph nodes, which is also a normal finding. I'm going to also palpate her thyroid. I'm going to step behind her and check to make sure that when she swallows, I don't notice any swelling. Have you swallowed them? Good deal. Don't notice any, you didn't have any difficulty swallowing, okay? I'm going to also assess her temporomandibular joint. Noted any bumping or clicking. Can you open for me? Good. Close. It was good. Any tenderness with that? No. Good deal. I'm also going to further assess Megan's eyes, looking for the red reflex, looking at the vessels in her eyes as well. I'm going to be using my ophthalmoscope for that. I will be getting pretty close to your face. Sorry. And there will be a light, okay? Also looked at the optic disc. Her red light reflex was present as well. I'm also going to check her pupils to make sure they're equal round and reactive to light. I would normally dim the lights for this, but for the purposes of the video, I'm going to just leave them on. Perla is present. I'm going to look at the conjunctiva, make sure it is pink and moist. I don't see any abnormalities with that. She doesn't wear contacts or anything at this time, which is great. To further my assessment, I'm going to start by listening to her lungs, and first of all, I will palpate. I'll inspect, so I don't know any abnormal breathing. I'm going to go behind her. I'm going to assess her ability or symmetrical expansion of her lungs. I'm going to place my hands around your waistline. You will take a deep breath for me. Hold. Okay, release. Good. There was symmetrical expansion. I'm also going to place my hands on your back each time I reposition if you will say 99 for me, okay? I'm going to assess for tactile fruitus.
99, 99, 99, 99.
Good. And I was able to feel it vibrate, which is a normal finding. I'm going to do this same on the front of her chest, if you don't mind me placing my hands over your breast, okay?
99, 99, 99.
Okay. Don't know any abnormalities there either. I'm going to listen and auscultate with my stethoscope, starting with the diaphragm and then the bell. You'll just take a deep breath each time I place my stethoscope, okay? Her breath sounds are clear bilaterally, which is a normal finding. I'm going to do the same on the anterior side of her as well. So as far as her lungs go, there were no abnormal findings with that. To move on to my cardiac exam, I will be inspecting first to make sure her chest, I don't know any abnormalities with that. And then I will be palpating and auscultating and percussing as well. So I'm just going to start by feeling over your series of imports, okay? The area of maximal impulse. I'm able to feel her heart rate. Okay. I'm going to assess her arteries at this time, feeling for pulses. 2+, which is normal. Her carotids are good as well. Okay. I'm going to listen to her heart now, starting with the ankle, pulmonary, Herb's point, mitral, I don't know any abnormal heart sounds, just normal S1, S2, which is great. I'm also going to listen with the bell of my stethoscope. I don't know any bruise or murmurs. I'm going to listen to her carotids as well. I do not know any bruise there either. I'm going to have you lay down and I'm going to assess for jugular venous distension. I'm going to have you turn your neck to the side. Good. I don't see any, which is also important in our cardiovascular exam to look for this. I'm going to have you sit back up now, I'm sorry. I'm going to assess her brachial arteries. Normally at this time I would also assess her femorals, but for the purposes of this video to maintain her privacy, I'm not going to do that. It's also good to check for capillary refill. And throughout my exam, I'm also examining her skin. Her capillary refill is within less than 2 seconds. I'm checking for clubbing in her hands. I don't know any lesions on her body at all. To move on, I'm going to assess her abdomen. I'm going to start my process with this a little different. I'm going to inspect and then I will auscultate, because if you percuss and palpate first, it can change your findings. So I'm going to have you lay back for me. I'll sit you up just a little bit. Moving the table over just some. So I've inspected, I'll lift up her shirt just a little bit. I don't know any abnormalities with that. It doesn't seem to be protuberant. She's got a flat little tummy. I'm going to listen to all 4 quadrants. Sorry if my hands are cold. She's got bowel sounds present in all 4 quadrants. I'm also going to auscultate her renal iliac arteries as well to know any bruise at this time. Also listen at her epigastric region and at her aorta, and I don't know any abnormal findings with that. Then I'm going to start with light palpation. Let me know if you feel any tenderness, okay? Okay. And then I'm going to deeply palpate, noting if I feel her liver or spleen. I don't feel anything. I don't know any hernias, bulges at this time. I could also, at this time, I'm going to percuss her stomach, but I could also percuss the borderline of her liver, and I will also palpate a little deeper to see if I feel her liver, her spleen, or possibly her kidneys. Take a deep breath for me. I'm not able to palpate her liver, her spleen, or her kidneys. I'm going to percuss your stomach as well. You might feel me tapping, okay? All right. I don't know any abnormalities with that. I didn't get to feel your pulses on your feet earlier with your cardiac exam. I'm gonna have you sit back up at this time. Something I also noticed that I missed, I did not percuss on her back. I'm gonna do so at this time to percuss her lung sounds, okay? That was a normal finding. I did not notice any dullness. It was resonant. Next, I'm going to assess her musculoskeletal. We'll start by doing range of motion exercises. I'm going to have you stand up for this part of the exam, okay? I'm going to have you reach behind your head. Good. Reach behind your back. Bend your knees for me and touch your toes. You can sit back down. Was any of that difficult for you? Okay, good. She appears to have good range of motion. I'm going to start by doing that in your neck as well. Can you look down at your chest and back up to the ceiling and all around? Any tenderness with that? Good. I'm also going to assess the strength of her neck at this time. I'm going to have you resist against the pressure, okay? Good. Again. Good. Will you shrug your shoulders for me? Good. Will you squeeze my hands? Whoops, sorry. Good. She's got good grip strength. Will you push on the bottoms of my hands? Good, like you're pressing on the gas pedal. Her strength appears 5 out of 5, so normal there. Going on to neuro, we will assess her reflexes. I'm also going to assess her cranial nerves during this part of the exam as well. All right, if you will place your arm right here on mine and turn it up. There we go. Sorry. That is a normal finding. I should feel a flinch in her when assessing her bicep, okay? Now I'm going to assess her brachioradialis. And I noticed a flinch in her thumb. That means her reflexes are intact. For this part, I'm going to have you stand up so it's a little bit easier to relax your arm for me. All right. Good. Did you see that flinch? I don't know if you got that. I'm going to do it on this side too. There we go. She's got good reflexes. I'm going to have you sit down for me. I'm also going to assess her patellar reflex. This is the one that everybody's most commonly familiar with. Good. I don't know if you could see that, but she did have normal reflexes there. And I would also assess her Achilles. I'm going to take one of her shoes off just slightly. And she's got good reflexes there as well. To further do my assessment, I'm going to start with the cranial nerves, starting with one, which is her olfactory. That's going to assess her smell. Something I also forgot to do earlier was have test her with her sinuses, test her ability to blow in and out of one nostril. So I'm going to do so at this time. Snip. Good. Snip. Good. All right, I'm going to have you close your eyes. Do you have any allergies to anything? Good. Can you tell me what you smell?
Alcohol.
Good. So cranial nerve 1 is intact. To assess cranial nerves 2, 3, and 6, I would also assess her perla earlier in the exam, and I'm going to do another test called the H test to assess her ability to follow with her eyes, okay? A lot of times during this, patients like to move their head up and down, so I'm going to place a little bit of pressure over your head so you just follow with your eyes, okay? Good. So her ocular movements are normal. So I've assessed her optic, her oculomotor, and cranial nerve 6 as well. Next, I'm going to assess her trigeminal nerve. I've tested her ability to open, and she had no popping or clicking. Will you clench your teeth for me? Good. No abnormalities there. Her facial, I'm going to have her puff out her cheeks, smile at me, and also test her sensation to dull and soft touch. Okay, can you smile? You've already done that. Puff out your cheeks like a blowfish. Good. She doesn't appear to have any difficulty with that. If you'll close your eyes, I want you to tell me if it's sharp or dull. I mean soft or dull.
Soft.
Okay.
Dull. Soft. Dull.
Okay, her sensation is intact there. And that tested her facial nerves. I'm going to test cranial nerve 8, and that will test her acoustic or her vestibulocochlear. I'm going to do so by doing the Rhine and the Weber test, testing starting with the Weber. I'm going to use a tuning fork. I will hit this, place it on your head. I want you to let me know if you hear it in one ear or both ears, okay? Good. That is a normal finding. Next, I'm going to do the Rhine test, assessing air versus bone conduction. So I'm going to only do this on one side. Normally I would do it bilaterally, but I'm going to place this behind your ear. It might feel a little bit of pressure. You just tell me when you can't hear it, okay? Can't hear it. And the same with this one. Can't hear it. Okay. She was able to hear air conduction longer than she was bone conduction, which is normal findings. And that tested, further in her ears as well. To assess further in the vestibulocochlear cranial nerve 8, I'm gonna perform the whisper test. I could also do a Romberg test where I had her stand up and be able to assess like her ability to stand without swaying. But we'll do the whisper test now. If you'll just repeat the words that I say.
War. Eagle.
Okay, War Eagle. She was able to say it. So her cranial nerve 8 is intact. At this time, I could also do cranial nerve 9, which is her glossopharyngeal. I would assess her gag reflex. However, Megan has opted not to do that at this time, which is fine. I don't think she has any difficulties with it. She's able to talk normally so we won't assess that. I've already assessed her ability to swallow, so cranial nerve 10 should be intact with that. I've already assessed her neck and shoulder muscles, so cranial nerve 11, which is her accessory muscles, are intact. And now we're done with we'll start with cranial nerve 12, her hypoglossal. So I'm going to have her stick out her tongue. Okay, can you move it up and down, side to side? Good. That's intact as well. I'm also going to have her stand up and test her balance. I didn't notice when she was standing to do her range of motion exercises that she was off balance. But now I'm going to have her lift her foot to her shin and dress it down. Okay, good. She didn't have any abnormalities with that. And we'll go ahead and do the Romberg test at this time. If you'll just close your eyes and hold your arms out to your side. Good. Sit down for me. No abnormalities there. She doesn't seem to be having any problems with vertigo. I believe that concludes my assessment at this time. I appreciate you for coming in and letting me do this, and thank you so much.